Dear all, welcome to this webinar about Bioptron in diabetic food and other chronic ulcers. I don't know if you know, but diabetes affects quite a lot of people. Specifically in Jordan, in 2 years, it increases of 2% of the population affected by diabetes. And it's expected that in 10 years, diabetic people will increase until between 1 and 3 millions of people living in Jordan. But most probably this number is even higher because this pathology is very undiagnosed. But first of all, what is diabetes? Diabetes is a chronic pathology characterized by a high blood sugar level over a prolonged period. Diabetic patients should pay more attention to maintain stable blood glucose level. But how that happens? So our stomach transforms our food in sugar, that is the energy that our cells need. This sugar will be then going into the blood circulation and will be distributed to all our body. The cells will take the sugar from the blood, and then the excessive sugar should be stored in fats. This is thanks to the pancreas and the insulin. The problem is that if this process is not properly done, the sugar will stay in the blood circulation. Complications and symptoms of diabetes are very diverse and can compromise patients' life quality. Scepter International provides a wide range of products to maintain a healthy life, which is especially important for diabetic patients. Diabetes can reduce the blood supply to the feet, causing a loss of feeling and/or wounds. In addition, food sores and injuries take longer times to heal due to diabetes, leading to ulcers and infection. This complication is very well known in medicine as diabetic foot. Bioptron Hyperlite system is a phototherapy medically certified device which accelerates wound healing, also for diabetic foot, triggering several cellular mechanisms which synergistically will improve healing process. The recommended treatment time is between 2 and 8 minutes at a distance of 10 centimeters, 1 or twice a day for as long as you need. Bioptron Hyperlite therapy is the solution to accelerate wound healing and decrease the pain. But which are the cellular mechanisms that are triggered by Bioptron and that are so beneficial for wound healing? Bioptron fosters reparative and regenerative processes, increasing fibroblast proliferation and migration, and collagen production, pivotal for soft tissue regeneration. Bioptron also increases microcirculation, improving blood supply and angiogenesis of new capillaries. This vasodilatation will also contribute to decrease the pain by preventing the ischemic pain. Bioptron Hyperlite therapy reinforces the immune system, helping the organism to fight effectively against external pathogens, decreasing risk infection. Bioptron also decreases the inflammation by modifying the secretion of specific cytokines. A high number of articles prove that Bioptron Hyperlite therapy decreases the release of inflammatory molecules and increases the anti-inflammatory ones, producing a synergic effect to diminish inflammation and swallowing. And also, and most probably you know, Bioptron is medically certified to relieve the pain or decrease its intensity by decreasing the release of inflammatory molecules and nociceptive signals. The neuropathy that could arise also a collateral complication of diabetes can cause tingling, numbness, burning or pain, usually in the lower extremities. And this can be decreased thanks to the use of Bioptron, which is improving the life quality of patients in daily basis. Now, I will present you some of the articles and clinical trials that we have in diabetic foot with Bioptron. So I will prefer to prevent you about not nice photos always, but I think you will stay with the main information. And also I will like to highlight that I prepared a newsletter with some studies that are presented here for the first time in a medical newsletter that will be distributed to you in a way you can have more information and you can share with your patients and clients. In this study, the researchers compared two light therapy methods, one with LAD and another one with Bioptron Hyperlite therapy. So they treat one group of patients with LAD and another one with Bioptron Hyperlite therapy. The protocol was 3 times a week, 8 minutes after cleaning during 8 weeks. So what they did, it was to measure the area and the depth of these diabetic foot ulcers. As you can see here, they calculate the percentage of the healing of this ulcer. And you can see in both groups, this was decreased, the area and the depth, but this percentage were higher in the group treated with Bioptron Hyperlite therapy, showing that the percentage of healing was improved. So the results show that in both methods are good for healing process, but the improvement was much better in the patients that were treated with Bioptron Hyperlite therapy. In conclusion, Bioptron Hyperlite therapy is more effective in accelerating the healing of grade 2 diabetic ulcers. In another study, the doctors compared the time of the diabetic foot already in diabetic patients, and they compared it with the time that take the diabetic the diabetic foot ulcer to disappear. So in that case, they treat with Bioptron Hyperlite therapy once a day for 8 minutes after the cleaning the ulcer until the wound was completely healed. As you can see in this graph, they separate all the diabetic foot ulcers in function of some symptoms. This is not important, but what you can see here is that independently of the symptoms, all these patients were suffering from this diabetic foot for very long periods of time, sometimes even years. This is in weeks. After using Bioptron, you can see here that these ulcers were healed very fast. In between 2 and 10 weeks, these ulcers were completely healed. Also, they divided the diabetic foot ulcers in function of the stage, so in function of the gravity. I will not enter in details, but as you can see here in the 3 types of stages of the ulcers, the patients were suffering for them for 1 year or more. And then thanks to the use of Bioptron, the time of this diabetic foot ulcer was significantly decreased. So the conclusion is that the average was that people were suffering from this diabetic foot ulcer for more than 1 year, and thanks to the use of Bioptron, in less than 1 month, they were healed. So ulcers gradually cleared, granulated, and epithelialized during the treatment. The healing time was substantially shortened and lower, and the ulcer pain was also lower in the patients that were treated with Bioptron. Here you can see some images of these diabetic foot ulcers that were treated during this study. Some ulcers that were more superficial, other ones that were more depth. All of them healed thanks to the use of Bioptron. And also, even in cases that was required to amputate some parts, you can see how thanks to the use of Bioptron, it was completely healed and no complication in this part. Of course, Bioptron is used all around the world, and we receive quite a lot of cases from patients from different countries. I will just put you some examples. Those are already compiled in previous newsletters, in which, in that case, for example, the patient were 66 years old. He burned himself because a radiant heater. And as you can see here, the wound was, after 19 weeks, the wound was not closed. He started to use Bioptron, and you can see how gradually the wound is being healed until disappeared completely 15 weeks later. Also, in that case, in this patient in which hyperbaric chamber didn't work for him, it's another method. Thanks to the use of Bioptron, the foot was less inflamed, the wound started to heal, and then the foot arrived to have a normal shape. You can see how the foot is perfectly functional and the ulcer completely healed. Also, in that case in which the foot was quite affected, thanks to the use of Bioptron, the ulcer was healing progressively, and you can see at the end how we can even not see that an ulcer was there. But unfortunately, the diabetic foot ulcers are not the only chronic ulcer that exist. Chronic ulcers are areas, mainly in the legs, ankles, or feet, where underlying tissue damage is caused by different reasons and is causing skin loss, leaving a raw wound that can take longer periods of time to heal. When I say long periods of time, it could be months or even years. The causes are very diverse: high pressure in the veins, being overweight, not having a lot of possibility to move. And the treatments are very diverse. You can wear plasters or you can wear dressings. Doctors can put the legs above the heart. They can advise to take a walk or execute it every day. But there is no one magic treatment. They try to combine more of them to try to potentiate the healing of the wounds. I will present you some studies that has been done with Bioptron in these pressure ulcers. In that case, for example, it was a study in which they compared people, disabled patients, so they don't have so much motility, that have already pressure ulcers. So one group was treated only with the normal wound care, and another group received exactly the same wound care treatment, but with Bioptron Hyperlite therapy. The protocol was twice a day, during 10 minutes after the cleaning of the wound during 1 month. And the doctors, what they measured, it was the area and also the volume of these ulcers. As you can see here, the area of the ulcers before the treatment was the same for both groups. But after 1 month of treatment, the control group that only received the wound care had the same surface of the wound, but the group that was treated with Bioptron, the area was significantly decreased. The same result was obtained also in the volume. The volume in both groups of the ulcer was the same, but thanks to the use of Bioptron during 1 month, the volume of the ulcer decreased, meaning that this ulcer was decreased also in size. Bioptron Hyperlite therapy enhances the healing of pressure ulcers in disabled people that has reduced mobility. Of course, this is not the only study that Bioptron has. In another study, they did the same protocol. Okay, in that case, it was pressure ulcers in the sacral region, so the very low region of the back. And one group was treated only with the standard wound care, and another group was treated additionally with Bioptron Hyperlite therapy. The protocol was 5 times a week during 10 minutes after cleaning for 1 month. As you can see also here, after 1 month of treatment, the group that was treated with Bioptron, here in violet, you can see how the size of the ulcer decreased. And it's not the case of the group in red that didn't receive Bioptron. They even increased slightly the area of the ulcers. So this allowed the doctors also to divide the ulcer in function of the rank and the scale. I will not enter in details, but you can see here that it's in the group of Bioptron, the rank of pressure ulcer decreased only in the group treated with Bioptron, and it was exactly the same for the scale. They decreased in the scale, but the control group didn't change. This is one example of one ulcer in this sacral area treated with Bioptron. Patients treated with Bioptron Hyperlite therapy had significant improvement in the pressure ulcer healing. Once again, we have a lot of other cases to present you. I just selected some of them in which you can see how elderly people, in that case with venous leg ulcers, so they don't have a good blood supply, and since they are elderly in general, they have other health problems. They can heal their venous leg ulcers without side effects, so without compromising other treatments. In that case, this person have several venous leg ulcers in the same leg, and you can see how the 3 of them were completely healed after some weeks of treatment of Bioptron. In 3 months, they were completely closed. Also, in that case, this person have different venous leg ulcers in both legs. I choose 3 of them, and you can see how along the time these ulcers were completely healed, the inflammation decreased. But also can take place in other parts of the body. You can see here, for example, in the buttocks area, this person that was suffering from that since 3 years, you can see how the use of Bioptron not only helped to heal the ulcer, but also to decrease the inflammation and the pain all around the area. The same thing for the heel. In that case, the health professionals were desesperated because the ulcer was becoming bigger and bigger. And thanks to the use of Bioptron, you can see how the infection was decreasing, the healing of the wound was improved, and it was almost completely closed in 2 months. Of course, we have also the same results in other more complex ulcers, as you can see here. and we arrive always to the same conclusion. The use of Bioptron Hyperlite therapy help the healing of the ulcer and also to decrease the inflammation and the pain, allowing a healthy tissue regeneration. So I hope you learn more about our medically certified devices. As you know, Bioptron is very effective, long-lasting effects without side effects. It's very comfortable and it's very convenient because it can be used in clinics and hospitals, but also at home use, especially for these people that has a reduced motility. The time of use is between 2 and 8 minutes, 10 centimeters distance, 1 or twice a day. But as you can see, as you've seen in our studies, other ways to treat it more or less often have also fantastic results. Finally, I would like to finish with this complementary therapy. You know that we have our sets of Bioptron color filters, and in the case of chronic wounds, you can use as complementary therapy the blue and the indigo color for 2 and 4 minutes, always at a distance of 10 centimeters, to improve the wound healing in terms of epithelialization, quality of granulation tissue, and subjective feeling. Thank you very much, and I hope you enjoyed.